Major depressive disorder and severe anxiety are systemic conditions that place the entire nervous system under a continuous, straining pressure. When the body's mood, fear, and stress responses are dysregulated, it creates a persistent physical burden. To counter this, medical professionals often look to sertraline as the first-line pharmaceutical intervention. Doctors select sertraline because of its broad effectiveness across multiple disorders and its safety profile compared to older antidepressants. It carries a lower risk of toxicity in an overdose and is frequently preferred for patients with cardiovascular disease or those in perinatal settings. Even with its widespread clinical use, the drug's timeline contradicts typical expectations of how medication interacts with the body. In this microscopic view of a neural synapse, sertraline physically blocks the serotonin transporter, or SERT, a gateway that recycles serotonin. By blocking these gateways, the drug prevents reabsorption, causing serotonin levels in the synapse to pool and multiply immediately. While this chemical shift begins within hours of taking the first dose, most patients notice no immediate change in their emotional state or symptoms. This raises a central question for researchers. If the chemical environment of the brain changes almost instantly, why does it take weeks for a patient to feel better? The first 2 weeks are defined by the body's reaction to this sudden serotonin surge, which can trigger physical side effects before any therapeutic benefits appear. This logic chart maps interactions doctors must monitor. Overloading the brain with serotonin triggers dangerous serotonin syndrome. Sertraline cannot be taken with MAOIs and requires monitoring with triptans or other antidepressants. Also, mixing with NSAIDs, aspirin, or warfarin increases bleeding risks. In some patients, the drug also requires monitoring for its effect on the heart's electrical cycle, specifically a condition called QT prolongation. These initial weeks represent a period of chemical adjustment for the body, where clinical focus is on safety and monitoring, rather than immediate symptom relief. Around week 3, the physiological focus shifts. The delay in relief suggests that treating depression involves more than just increasing the amount of a single chemical in the brain. This network represents the brain's interconnected neural circuits. To respond to the serotonin-rich environment, the brain undergoes downstream neural adaptation. Over several weeks, circuit receptors adjust their sensitivity and physical structure. The nervous system physically reorganizes pathways responsible for fear and stress responses. Relief typically follows a staggered timeline. Cyclical symptoms like disrupted sleep, poor appetite, and acute anxiety often improve first as circuits adapt. However, core emotional symptoms like a low mood or anhedonia are linked to more complex circuits, which typically require a full 4 to 6 weeks of structural change before a patient notices a benefit. The delay in feeling better is the time required to complete this structural reorganization. Between weeks 4 and 6, the accumulated changes in the neural circuits allow the core symptoms of depression to begin to recede. While these biological changes are significant, the medication does not address the external life stressors or psychological roots of the condition. Its function is to reduce the biological symptom burden to a level that the patient can more easily manage. By stabilizing the brain's stress response, the drug provides the biological bandwidth necessary for a patient to engage with the actual process of healing. Long-term recovery is built on using that stability to pursue psychological therapies like CBT, regular sleep routines, and broader lifestyle adjustments. While specialists may use multiple medications for severe cases, pairing an SSRI with environmental and psychological support is the standard foundation of care. By managing the physical symptoms of the disorder, sertraline provides the brain with the time and space required to navigate toward a full recovery.